My name is Dr. Jacqueline Kitulu. I'm a general practitioner for the last 24 years. I have today partnered with Ponea Health on this educational video on diabetes. So how do we manage diabetes at home? Now, the key to managing diabetes at home and what I've found works very well for my patients, number one overall is diabetes education. And I have ensured that, and I encourage all diabetic patients to have a session with a diabetes educator, because a lot of what the diabetes educator will work around all the factors that you as the patient will control. And that will range all the way from your diet, in terms of self-care, foot care, the things that you need to look at, exercise regimen, how to take your insulin, for example, for those who are on insulin. So all those are areas that empower you as a patient in terms of managing diabetes. So I find that point very critical in terms of managing diabetes at home. Now, once that knowledge is there and one is fully empowered on that front, then it goes back to simply doing the things that we've talked about. It is managing what you eat at home and ensuring that you're eating the right things. It is ensuring that you exercise, and we had said minimum of 30 minutes most days of the week, managing your weight. And then now we move to the medications. If you are on insulin, taking your insulin as prescribed. For those who are on oral medications, taking your oral medications as they are prescribed. Now, as you take your insulin or your oral medications, you also have to monitor your blood sugars. And most diabetics, we recommend that one should have a glucometer for the home glucose readings, so that one can assess their glucose measurements and tell how well the control is. And how do they know that? There's the fasting sugar. This is the sugar that is measured when you've just woken up. Remember, I had given you the parameters. It should be less than 6 millimoles per liter. Then the other measurement that we require to be done is what we call the postprandial sugar. And this is a sugar that you measure 2 hours after a main meal. And why 2 hours? Indeed, when you do eat, your blood sugar rises and it will go to a peak and then drop. So 2 hours after a meal, the blood sugar should be below 10 millimoles. So those two readings are very critical, and usually I'll recommend for my patients to do those, especially those who are fairly well controlled, that they can do this even 3 or 4 times a week and chart them. It's important to chart them, because one single reading sometimes will not give you the full picture, but when you have a chart of the readings, then you can see where they fluctuate, go up or down. In fact, many of the diabetes diaries or blood sugar diaries will have those different areas apportioned out that you'll measure, but also a gap for you to write what meals you have eaten. Then it empowers the patient to realize that, when I eat these certain foods, my sugars rise too high. If I eat certain foods, my sugars are good. So then it further empowers the patient to manage their own diabetes at home. So there's your lifestyle things that you're doing, you're exercising, you're eating right, you're checking your feet, you're looking at all those aspects, you're taking your medication as required, and then you're monitoring your sugars. This is the sort of information that you come back to your doctor with, at the intervals that your doctor has set to review you, because then you come armed with information about how well you have been doing at home. So in summary, that's how I would manage a diabetic patient at home. For the ones who are on insulin, of course, that requires taking insulin more regularly and more regular measurements, because, of course, the insulin drops the sugar quite a bit. So more regular measurements of the diabetes or of the blood sugar are needed. And again, that enables your doctor to work with you to adjust the levels of insulin that are required. I must mention that, of course, now there are also insulin pumps. That's a newer innovation that one doesn't necessarily have to measure for the type 1 diabetics. They don't have to literally inject themselves all the time. They can have an insulin pump that's attached to their body, and it just releases their right amount of insulin at the right time. So again, those are new innovations that are there. But a lot of home management, what your doctor is prescribed, is targeted at ensuring that we prevent the complications of diabetes which are more hazardous than just the simple symptoms that you'd feel at the onset. So can a diabetic person live a long and healthy life? Absolutely. A diabetic patient who is well controlled in terms of their treatment, their blood sugar levels, and all other risk factors assessed that they are clear, can live a very long and healthy life and be able to do just about anything. They can take part in sports, they can they can live their careers to the, they can live out their dreams, literally. So the key is really just managing the blood sugar, preventing the complications, and there is no reason why a diabetic cannot live a long and healthy life. So my recommendation for all diabetics is that do what your doctor is telling you to do. Have your regular checkups so that we are constantly assessing how you've been managing at home. What is your long-term glucose control? How well are you managing it when we do certain tests? And we also assess the other likely complications. How is your kidney functioning? How are your cholesterol levels? How, all the other areas that may be, related to diabetes, and making sure that we are targeting and dealing with them on time. But a long, healthy life in a diabetic patient is very possible. Thank you. So thank you very much for having joined in this series, listening to hypertension and diabetes. It has been my pleasure empowering you to manage your hypertension or diabetes at home. You can reach me through ponea.com for my services for managing your hypertension or diabetes. Carry on.